welcome to Pet Paul Vision channel. This channel is maintained by Professor Dr. Amalendu Chakrabarti. As per demand and desire of the pet-loving people of society, this channel is launched for various aspects of pet care management. We feel proud to open such a channel to raise the voice for them. If you like our channel, please subscribe us.
Dear viewers, today I am going to discuss on dog bite, which is really a public health threat to society. You know, dog bite is a very frequent phenomenon and people are very much apprehensive about dog bite. You will be surprised to hear that in our country around 20,000 people used to die due to dog bite every year. Now, when the question of dog bite appears, dog used to bite for various reasons, of which most important concern is bite due to rabies. But besides rabies, dog may also bite due to some other reasons. And the reasons are, one is known as nipping bite. That means a pup used to bite very frequently to anybody which is nearby and bite at the hands, feet, legs or anywhere in the body of the owner or the man or woman who is keeping the dog. So the nipping means go on biting, and this biting by a pup is frequently made, and the owner is to come to us asking that, doctor, my dog pup is biting and whether this bite is going to affect me or not. Nipping bite is actually bite as a result of some psychological problem or as a result of teething. That means the pup through biting or through nipping bite try to replace the male teeth and to give space for the permanent teeth to erupt. And the bite is so sharp and keen, it is very, very painful. But one thing I want to emphasize upon that this bite is non-harmful bite. It may create some abrasion or wound, but it is not going to affect the individual. I have already told about nipping bite, and next bite is provocative bite. That means the dog is somehow provocated. That means it is excited. And it may be due to some injury caused by the owner to the dog, and that's why it is biting. That means when there is any provocation, that means when the dog is feeling that somebody is going to beat me, right, or punish me, or it has injured me. So in that cases, it may bite. That is provocative bite. That means some provocation is there for which it is biting. And next bite is unprovocative bite. This is very, very important. Unprovocative means there is no reason for biting. There is no cause of biting, but the animal is gone biting indiscriminately. Whoever in his path is biting him. And this bite is mostly occurred due to rabies, which is a very, very important deadly disease of man. Rabies is such a disease which actually causes fatality. That is 100% death if rabies occurs in man. But when rabies occurs in dog, in that cases it will go on biting, and it will go on biting all the animate and inanimate objects around the dog. Or it may go on in a village, in a circle, and go on biting everybody, including the man, animals, even the cattle, goats, sheep, whatever it may be in his vicinity, it will go on biting. So, and it will go on biting in a circle. That's why sometimes we call this disease as a circling disease. That means whoever comes in the circle, that fellow will be beaten by the dog because it is suffering from rabies. It's a very important disease. Now again, when the question of rabies comes, rabies generally comes in three forms. One is stage of melancholy. In that cases, it will go on biting animate and inanimate objects like anything. And then stage of excitement or furious form. That means the rabies, the animal becomes very violent, very excited, very violent, and go on biting anybody, right? And the appearance of the animal is so ugly, so ferocious, that's why it is known as furious form of rabies, right? And third form is calm form, where the animal becomes docile. it goes in a corner, hide in a dark place, but the saliva is infected with rabies virus. That is to some extent dangerous, because people may not think that it is suffering from rabies, because it is remaining not in a furious form. Furious form, it is very easy to understand that the animal is ferocious. The animal is very much violent. But here it is not violent, docile. At the same time, it is carrying the virus, and therefore the arm form. Now the question, the virus generally excreted about 3 to 8 days prior to infection. That is very important. And the bite is not important. People used to say that my dog has bitten me. But the question is, biting is not important. Infected saliva is very important. Saliva remains infected even prior to 3 to 8 days prior to infection. Therefore, saliva, infected saliva is the root cause, not the bite. So again, if you consider the way of transmission, we see that the age of the animal is one of the factors. Young animals, they used to suffer most. They are more susceptible. Again, when you go for bite, the distance of the bite is also very important. A bite on the face has a contagion index of almost 100%, whereas on the body or leg is 2%. That means the distance of bite from the central nervous system is very, very important. Again, if it is bite is nearby head or shoulder, in that case, or facial bones, in that cases, the infection may spread within a very short span of time, maybe within 2 to 3 days. But if it is in the leg, if the bite is on the leg or hand, it may take some time, even up to 60 days. Second thing, the virulence of the virus. How much infection, how much intensity of the infection, that depends on the virulence of the virus. Then concentration of virus in the saliva, how much content of virus in the saliva, that is important, and the degree of wound, because there is hyaluronase content of the saliva which has got inducing effect. So these are the facts which have to be taken into consideration when the dog bite occurs. Again, I say the incubation period, many a times it may so happen people say the dog has bitten, but you do not know that when the disease may occur. Disease may occur not necessarily immediately. It may take 20 to 60 days. In case of man, around 60 days is required from the bite and manifestation. So there is 60 days span. Again, when you go for the exposure to the man, we got class 1 bite, that means slight to negligible exposure, minimum risk. Then class 2 bite, moderate risk. All bite except those only head, neck, face, palm and finger. And lick on face and scratch. And class 3 bite, severe exposure and grave risk. Bites are on the neck and above, and multiple bites, and therefore it is known as class 3 bite. Class 3 bite is very, very dangerous because it is nearer to the central nervous system. Now, when a dog has bitten, whether it is a rabid dog or a non-rabid dog, one has to take certain precautions. First precaution is that don't touch the wound with naked hand. When a bite occurs, try to wear a gloves or something, right? Wear a gloves and then touch. Don't touch directly or naked hand. Don't touch the area. Again I tell you, not only the animal, even don't touch the material used by the animals like chain, foot plates, bedding, etc. Because saliva, there may be saliva. These particular materials may contain the saliva. Infected saliva may be there. Therefore, don't use your naked hand. Avoid touching suspected stray or sick dog. Do not provoke any dog. If you provoke, it will bite. All staff and the laboratory workers who are working on rabies must take pre-exposure vaccine, PEV. And so far the risk is concerned, I tell you, veterinarians are at risk for their occupation because they have to treat the sick animals. Now again the question comes, whether I should go for vaccination or not. Some points where vaccination is mandatory. That means you are to take the vaccine without any fail, without any hesitation. What are the points? Point is, when the biting dog shows typical signs and tendency to bite without provocation. Person indiscriminately bitten by dog. Laboratory tests are positive, but dog does not show the typical clinical signs. In that cases, vaccination is mandatory. At the same time, I tell you, when a street dog, they bite and go away, that means you cannot trace the animal or cannot identify the animal. In that cases, it is wise to have vaccine. If biting dog run away while under observation for 10 days, because we say generally, if dog bite occurs, we used to suggest that you observe the dog for 10 days. If it suffers from rabies, it is usually expected that the animal will die within 10 days. But if it does not die within 10 days, it indicates that it is not suffering from rabies. But at the same time, when the animal is under observation for 10 days, if it goes away, if it is run away, in that cases, it is wise to have vaccine. In that cases, vaccination is mandatory. Some points where vaccination is not mandatory. When the bite is on the cloth without tearing and skin is unabraded, biting dog is normal and shows no signs of illness within 10 days of observation. In that cases, we may not take the vaccine. Treatment is very important because when a dog bite occurs, it is mandatory that one should wash the area with plenty of running water and soap. One has to pour the running water over the wound without touching. And it is wise to give some alkaline soap or detergent, alkaline, because the alkali used to kill the virus. So we will use running water with alkaline soap or detergent and pour over the wound for at least 15 minutes or 15 to 20 minutes. But don't do it naked hand. Area should be treated with antiseptic preparation then, and the area should not be covered with any cloths or bandage. It should be kept open. It should not be closed. And next important thing is that if you find that the area is to be stitched, it is very open and it requires to be stitched. But in this case, one should not go for stitching. Stitching of the wound is not necessary and should not be done because through the needle, the virus may go inside, and therefore stitching of the wound is not necessary or should not be done. But if the wound is very severe or the bite is very severe bite, in that cases, along with the post-exposure vaccination program, that means vaccine which has to be given on 0 day, 3 days, 7 day, 14 day, 30 day, and a booster on 90 days. Along with that, one has to go for some immunoglobulin, has to be injected in the area, in the wound. In the wound, we should use immunoglobulin along with the vaccination program. Immunoglobulin may be either ERIG or HRIG, that means human immunoglobulin or equine immunoglobulin. Finally, what I want to say about rabies, one should not be very much apprehensive about the disease, but one should keep a very close eye on the behavior of the dog. Because a rabies dog will have a different type of behavior, alteration of behavior. If you find your dog is behaving indifferently, either a docile dog has become violent or a violent dog has become docile, in that case, you should have to have a very keen notice on the animals so that you are in a position to judge. At the same time, you should see that whether there is hypersalivation from the mouth or not. Third thing is that the animal will be unable to drink water. It cannot swallow water because there is paralysis of the muscles of deglutition. Therefore, it cannot swallow. But one may say that my dog is drinking water. There is no problem in swallowing water. But I say that it is not drinking, it is just lapping. Water is not going inside. It is only lapping. Lapping doesn't mean that it is drinking. That point is also very important. So, when you suspect a case of rabies, first point is that you see it is not taking any food. Number two, it is biting indiscriminately without any provocation. Number third, there is hypersalivation. Number four, tail is elevated, right? And another number will be it is trying to run away. And it will not only bite the animate object, it will also bite the inanimate object also, right? Sometimes if a fly is flying, right, it will try to catch the fly. So that is hallucination, that is also there in the dog. So behavior alteration is a very, very important factor in case of rabies.
Hope you are liking our video today. If yes, like, share and comment. Also subscribe our channel. We will be coming soon with a new interesting video very soon.